Thank you.
So why don't we just start all with just start us from the beginning. Like, where did you go to med school and residency, and then how did you transition? Like, what was your first transition into something like non-clinical?
Sure. So I'll actually start all the way back in college, because when I went to college, I went to Haverford that I just mentioned, and I went with, I knew I was going to be pre-med. I knew I was going to go to medical school, but I also wanted to do public health. And I actually ended up majoring in something that was the equivalent of urban studies and focusing on public health and public policy. So it's always been a strong interest for me. So then I actually went to work in DC for a year in a large nonprofit there. And then I went to medical school in Buffalo, New York. Then I ended up doing my intern year in Long Island Jewish in New York City, because I had some family issues and I wanted to be back in New York City, where I'm from originally. And then I ended up coming back to Temple for residency, and I have stayed in the Philadelphia area ever since. My first job out of residency was with the Philadelphia Department of Health, because I really thought that I was going to be kind of a public health person. And I, within 6 months, realized that they were not going to give me kind of any opportunity for growth. I immediately started asking for sort of organizational projects, and they were like, no, we just need you to see patients. And I said, okay, I'm not gonna do that. And I ended up switching to a company called Bravo at that time that had actually these very innovative urgent care centers that were staffed by internists. And those internists did urgent care as well as hospitalist medicine in a couple of local hospitals specific to those Medicare Advantage patients. And that was really my first knowledge of Medicare Advantage, the payer space. And since then, I've more or less been in the same organization. I've now been sold 3 times. I'm on my 3rd transition, and I've done increasingly more administrative stuff. Pretty much within a year of starting, I got involved in STARS and HEDIS, and then became a lead hospitalist. And in 2019, I really started to look for something within, at that point, we were owned by Cigna, and I started to look for something fully non-clinical and a little bit bigger than what I was doing in the payer space. So I've been in that job now since 2020. As a market medical executive, which gives me a pretty large region between New York, New Jersey, Connecticut, Delaware, about 70,000 Medicare Advantage lives. And I have clinical oversight, medical economics. I could talk about that in more detail. And then at one point, I became the National Medical Director for Health Equity. That particular role has actually, I've sort of just been demoted. So I'm trying to sort that out, because I transitioned companies again about 4 months ago. So that's kind of the journey.